Hello and welcome to Anatomical and Directional Terminology. Today you're going to learn about the anatomical positions, the three planes that divide the body in different parts, and any directional terminology. So lots of definitions today. Make sure that you're understanding them. Make sure you're checking the Quizlet to study from, and let's get started. So when we talk about anatomical positions, we are talking about the position where the person is standing in the upright position. Their palms and feet are facing forward. So oftentimes in medical textbooks, we will always be referring to the anatomical position. Anatomical planes. So there's three different planes, and what these planes do is they are going to divide the body into different sections and allow us to view those different sections and have conversations about movements around those sections. So the first plane of motion is the one that divides the body into right and left halves, which is the median or the sagittal plane. The frontal or coronal plane divides the body into front and back, and then the transverse or horizontal divides the body in upper portion and lower portion. So let's break it down a little bit further. So the sagittal plane, or the mid-sagittal or median plane, we call it, is going to divide the body into equal right and left halves. So it's this guy right here. Just think of it as like dividing it right down the center. So you've got your right side of your body and your left side of the body, those equal halves. When we talk about it in terms of motion, so if you're moving and your right and left hand side are moving together, we would say like walking would be an example of moving through the sagittal plane. Doing a forward lunge or a reverse lunge are examples of moving through the sagittal plane. Our next plane of motion is the frontal plane. The frontal plane is going to divide the body into the front half and the back half, or the anterior side and the posterior side. We also call that the coronal plane. There aren't a lot of movements that occur in the frontal plane, but the one movement that you probably recognize the most are going to be lateral movements. So any side-to-side motion. So if you were shuffling right to left, or if you were doing a lateral lunge to each side, that would be an example of movement that would occur within the frontal plane. Students tend to get confused between the movement in the frontal plane and the sagittal plane, because the sagittal plane is only forward and back motion, where the frontal plane that divides the anterior and posterior are only going to be lateral or side-to-side motions. Our last plane of motion is going to be the transverse or the horizontal plane. That's going to divide the body into the upper portion and the lower portion. So any movement that would occur throughout the horizontal plane are going to be motions that involve twisting of the body right along that central axis. Another way to think about the horizontal plane is the sun sets on the horizon, or that horizontal line. Next, we're going to move into positions and directions, and we're going to be referring to this figure a number of times throughout this PowerPoint presentation. And so we usually describe these positions and directions when we talk about body parts and their relative positions to one another. So I'm going to be giving you guys lots of examples in reference to body parts. I put these together in groups so that you are able to kind of identify both of them together in those pairs. So the first one is superior and inferior. So superior refers to any structure that's closer to the head, anything that's towards the top. So if you think about if you have a job right now, your superior is somebody who's higher up than you. It's somebody that you report to. Where inferior is something that's going to be closer to the feet. And when we say that somebody is inferior to you, oftentimes we refer to them as lower than you. So when we talk about superior and inferior, we might say that the shoulder is superior, but the hand is inferior, because the shoulder is closer to the head, which makes it superior. The hand is closer to the feet, which makes it inferior. Anterior and posterior. So anterior refers to the front side of the body right here, where posterior refers to the back side of the body. Remember when I talked about the frontal plane divides the body into front and back portions, so it divides it into the anterior and the posterior view. Superior, oops, we went backwards. Sorry about that, guys. Wrong direction. The next two terms are going to be medial and lateral. So the term medial always means the middle or the midline, okay? Where lateral refers to something that's farther away from the midline. So we would say your belly button is medial to your elbow. Your elbow is lateral to your belly button. Your shoulder is lateral to your collarbone. Your collarbone is medial to your shoulder. So lots of examples you can do when we talk about medial and lateral. The last ones are proximal and distal. So when we use these terminologies, we are only talking about your extremities. Now, your extremities refer to your arms and your legs. And you can see right here, I have the term root written in there, which means when we talk about distal or proximal, we're talking about it in reference to that root. So where is that body part in reference to the shoulder or the hip? So when something is distal, think of it as distance. It is farther away from the root. When something is proximal, it is closer to. So think of close in proximity. So a couple examples here. The hand is distal to the elbow because the hand is farther away from my shoulder, where the elbow is proximal to the shoulder because it's closer to it. If we talk about our legs, we could say that my knee is proximal to my foot because it's closer to the hip, where my foot is going to be distal to my knee. It's going to be farther away. Superficial and deep. So when something is superficial, we would say that it refers to the surface. So something you might find on the outside of the body, where deep would refer to something that's in close to the core of the body. So we would say your sternum or your breastbone, that's the hard part on your chest that your ribs connect to, that is your sternum. So we would say that's superficial because that's closer to your outside of your body, right? You can feel that hard bone there. But your heart, you can't feel your heart per se. So we would say that your heart is deep. Prone and supine. So the word prone means that you're lying down, where supine, you're lying face up. Couple ways that you can remember that. Like a pro baseball player sliding into home, you are prone, where supine, lying on your spine, you can have soup poured into your mouth. So I always think of supine as being on my spine. You're laying on your spine or your back. So prone, you're laying on your belly. Supine, you're laying on your back. Okay, so now we're going to work on movements. You guys probably know these already, so I'm going to run through them quite quickly. A great little reference point here when we talk about those movements as well. So we'll go through all these guys on the list. So the first few are going to be flexion, extension, and hyperextension. So when we flex, okay, we might flex our bicep. We hear that term all the time, and you can see that in the picture. He's flexing his bicep. We would say that we decrease the angle. So the angle is getting smaller when we talk about flexion, especially with that angle between two bones. When we're in the fetal position or crouched down, we are flexing our joints. So we're decreasing that angle and pulling everything together. Extension is the other one. We're now increasing that angle between those two bones. And so if we're standing in our anatomical position, then we are extending or we're lengthening out and increasing that angle. Hyperextension, on the other hand, that is something that is, you do not want to hyperextend stuff because that is excessive extension, which means we are going beyond the regular anatomical position. And so you've probably seen this in athletes, professional athletes. They've been on Sometimes on sporting events, you'll see it where somebody hyperextends their knee or their ankle or their shoulder or their wrist. It bends the opposite direction, essentially way past the point that it's supposed to be at. And so here's another, excuse me, image. So remember, if we flex, we're bringing that wrist down. So we're decreasing that angle, okay? If we extend, we're straight out. Hyperextension would go past the normal one, okay? If we do a hamstring curl, we are flexing our hamstrings because we're decreasing that angle. And if I straighten that leg out, I'm extending it. And you can see hyperextension, that knee cavity would actually kind of bend inwards, which is super disgusting. And you would obviously have a really bad injury at that point. And then this last one here, when we talk about our elbow, if we're flexing, we're bringing it towards our face. If we're extending, we're coming back out to that 0 degrees. Hyperextension, you would have that injury occur at your elbow because you would go past that normal range of motion. Okay. Adduction and abduction. So let's break those down to help you memorize them. So ADD, I always think of that as you're adding it or you're moving it towards the midline of your body. So you can see in the image here, he's decreasing that angle and he's adding it. He's bringing it closer to his midline. Where abduction, you're taking it away from the midline. And so you can also think of as abduction where a child gets abducted. They're taken away from their family. And then adduction is just the opposite, coming towards the family. So if you were to extend your leg out laterally, having like a leg lift to the side, that would be abduct. Okay, so it's going away from your body. And when you bring your leg back to center towards the midline, you would be adducting. Pronation and supination. So this one is a little bit difficult for some people to latch onto. But remember, prone is the upward position, where supine is the downward position. So pronating, okay, you're turning it towards the bottom, okay? So the prone position, where supine, you're turning it towards the upward position. So this guy right down here, you're taking your palm. Remember, anatomical is palm facing forward. So if I turn my palm down, I'm now in the prone position because I'm face down. And when I turn my hands back up, and this guy right here, I'm in the supination or the supine position. We can apply this to our feet as well. If you take a look at maybe a pair of tennis shoes that you wear on a fairly regular basis, you can go ahead and look at the heel of your shoes. If you have a nice even wear pattern, more than likely your foot is in alignment and you're walking in a really nice neutral position. If your foot is in a pronated position, okay, remember prone, it's going to turn it in the outwards, right? So you can see that ankle is coming out. You're then going to get a wear pattern on the outside of your heel of your tennis shoes. Okay. Supination, just the opposite. Okay. You're going to get that wear pattern right on the inside of the heel. So take a minute to look at your shoes and see what you've got going on there, which is kind of interesting. Last couple little directional terminologies here. Rotation, okay? Remember, the only time you can rotate is if we're moving through that horizontal plane. So the neck can rotate, our torso can rotate. And how we describe that rotation is we can either externally rotate or we can internally rotate. So external means it's going to the outside or away from the midline. Internal is coming in towards the midline, okay? So your hips and your shoulders and your torso and your neck are the only things that exhibit rotation, but it's going to be the shoulders and hips that would do internal or external rotations. And that is it, you guys. Do some memorization.